Good afternoon, everyone, and welcome to our second webinar in the Partnerships That Work series, Getting Started in Community Partnerships. NLADA is excited to welcome you to the Partnerships That Work series, a 5-part webinar event helping civil and defender stakeholders to better understand the ins and outs of connecting to their programs and federal resources. The Partnerships That Work series is presented jointly by NLADA's Defender and Civil Legal Services divisions as a collaborative effort to connect stakeholders across the civil and criminal justice landscapes to resources, partners, and to spark innovation. You can learn more and register for any of our sessions or view session slides and videos on our website. My name is Emily Flanagan, and I'll be moderating today's event. However, I am also joined by Ellen McDonnell, who is with Contra Costa Office of the Public Defender, as well as Stephanie Harris from Ohio State Legal Services Association. Today, we'll be talking about community partnerships, best practices in building those relationships, and how to identify which partnerships make the most sense for your organization. As you begin to think about community partnerships, one excellent step in starting that process is thinking strategically about what your organization's goals are and what position you are in fulfilling the requirements of your clients and community. Identifying areas that you're able to provide resources needed without assistance or programs that exist outside of your organization. One way that I like to recommend organizations begin thinking about partnerships is identifying the unique value that your organization has to your community or to your clients, as well as gaps that your programs have that might be filled by other organizations or peers in this space. One thing to always keep in mind is the importance of monitoring and evaluation or program measurement. Are you able to adequately measure the value of all of your work, or are there areas where an outside partner may assist you into better communicating the value of your programs? There will always be cases where a partnership's opportunity benefit is less than the cost of supporting the partnership. If in forming a partnership, you would be taking on more work than is mission aligned, you may want to reconsider, as it may be too much work to take on for the value that your clients might receive. Once you've thought about the types of partnerships that may best benefit your organization, your community, and your clients, it's time to start thinking about who you might ask to work with you. Consider what stakeholders might make good partners. Many funders look favorably on partnerships or projects with strong support from a variety of different stakeholders in their community. Who in your area might work with you to make a more successful project or have a greater impact? One example would be to consider a small program that you currently have and how you might amplify or magnify that work. You may have existing formal partners or informal partners who can play a part in your programs or otherwise support clients directly. This may look like informal referral processes, casual meeting up with stakeholders for lunch, or just to talk about current challenges in the space. But these are opportunities that you might formalize in order to build stronger relationships in the future. If you think of your work and the support that your organization provides to clients as one stop on a very long road trip, you might also think about what other stops your clients make in their journey. Are there road stops before or after your organization that your clients connect to that you might build relationships with? For funding opportunities, it's important to know everyone else who might participate in your work at the start so that you might better identify funding opportunities that you could otherwise miss. For example, if a funding opportunity is released related to providing mental health support services to high-risk communities, you might consider as a public defender who is working to support clients who are in contact with the criminal justice system. As a mental health provider, you might consider What public defender offices and programs exist to support your clients who may be experiencing criminal charges? Once you've identified the ask and who you might connect with in your work, it's important to understand which portions of the work your office is already involved in and how you're measuring this work. What are the ways that this increased funding, partnerships, or support could impact or improve your work? Would you be looking for funding to expand the number of clients you're able to serve, to expand to a new community, or to provide deeper services to clients? In each case, it's important to keep in mind how potential partnerships would impact your work and the outcomes for your clients in a measurable way. Unfortunately, although our work is often difficult to measure, it's important to have some of that data and systems in place so that you can demonstrate to your funder the value of their support. How are the data and results generated going to enable you to justify your work and be more effective in the future? For example, imagine that you formed a partnership with an organization who receives transportation vouchers. These vouchers would allow your clients to be more able to attend key appointments and improve compliance with other responsibilities. How will you measure the value of this partnership? How will you measure the change in outcomes for your clients? How might you and your partner use this as justification to expand the voucher program? In this example, you might measure the value of the partnership in the face value of those transportation vouchers. You might also measure the value of the program in the face value of what other transportation options might have been utilized. Measuring change in outcomes can be complicated, but in this case, being able to measure the rates of compliance and attendance at key appointments will be something that external stakeholders as well as funders would very much want to know about. Once you've created a list of potential projects as well as partnerships, those activities that you would like to expand or engage in and who might support you, it's important to think about what government agencies or types of organizations might be interested in funding this work. Thinking about the words used and the secondary stakeholders for each type of opportunities will be key. Federal agencies like the National Institutes of Health and the National Institute of Mental Health have programs focused on mental health. The Department of Labor supports reentry and employment programming. The National Institute of Health and the U.S. Department of Health and Human Services have programs focusing on drug use. And U.S. Department of Justice supports programming related to justice reform. For each of these federal divisions, you might think about the types of services that more traditionally fall under that agency's heading that you provide as an additional or wraparound support to your clients. Private foundations often fund affinity groups or focus on geographic areas. For example, funders for LGBTQ represents funding opportunities totaling over $1 billion annually. AAPIP focuses on funds for Asian and Pacific Islander communities, and ABFE members invest in African communities nationally. McCormick Foundation has strong programming throughout Illinois and in the areas of community and poverty, as well as veteran and military family support. If you provide services to clients that fall within these geographic areas or affinity groups, these might be additional opportunities for your office to find funding for key programs. Now I'll hand it over to Ellen McDonnell of the Contra Costa Office of the Public Defender, but stay tuned for our future webinars taking place over the course of the next several months. Thanks so much. Ellen?
Wonderful. Thank you for asking me to speak on this topic. So our office was fortunate enough to receive a Smart Defense grant. And for those of you who are not from the Bay Area, we're from a county that's within the San Francisco Bay Area called Contra Costa County. And the unlikely partnership that was between us at the Public Defender's Office and the Richmond law enforcement, the Richmond Police Department. Richmond's an area that had a significant amount of crime, and in the area of Richmond where we launched this partnership, the police had already had numerous outreach programs to help reduce instances of violence. They have what's called a ceasefire program as well as other partnerships. So when we thought of this idea, this partnership seemed to be rational to us and to be a good fit. We were thinking of focusing on early representation from that would start the moment a person is cited and the moment they have contact with the police. And this is about not only connecting them with early social services, but also intervening as early as we can in the case and making sure that people are able to make their initial court date and not fail to appear in court. And one of the issues, one of the problems we were looking to address with our grant, again, was this issue of people failing to appear, missing the first court date, which often had to do with confusion about the court process and with not having been notified about that first court date. So we approached the Richmond Police Department and talked to them about, putting together this grant application, and we explained to them that this would be a partnership and that it would be really critical for both agencies, and that it would also be really helpful to the criminal justice stakeholders and to other organizations in the community. And we talked about bringing people from their community into court due to failures to appear, and that these failures to appear and that people missing court was also a root cause of cases not getting resolved very early in the process and cases, lingering on beyond the first court appearance and people, making multiple court appearances on their criminal filings. And from the moment we broached this idea with the Richmond Chief of Police, he was on board, he agreed, he felt that this problem of people failing to appear on these low-level cases was really endemic and was impacting the Richmond Police Department in a really significant way. And the timing of this was that, we had a relationship with the police department in Richmond. We had a relationship with the Richmond Chief of Police, and that was through realignment efforts in California to address the overcrowding in our prisons. As part of realignment, without getting too much into the weeds about the funding source for our program, it had been looking at moving people from state prisons to county jails, and as well as moving people from state prison to county jails, a lot of funding was shifted in the process of that happening. And through those funding shifts, we had a round table of criminal justice stakeholders, and part of that round table was our Contra Costa public defender who sat as a stakeholder in that group. And at that point, our chief public defender was working really closely with the Richmond Chief of Police, who was also sitting at that table, and they were really able to discuss this proposal in depth. He was very enthusiastic about it, and they were able to work out their concerns. And unfortunately, after we submitted that initial proposal, we weren't awarded the Department of Justice grant, but because we believed the work was really significant and meaningful, we brainstormed and regrouped and tried to find another way to make the funding happen. And as we sort of approached the AB 109 group for funding through AB 109, through these realignment dollars that come to our county, the chief of police at the round table at that point had changed. They do rotate, and we had a chief of police from the Antioch Police Department, which is another part of the eastern part of Contra Costa County, and he had heard about our proposal for this partnership, and he was enthusiastic about launching with his police department in his city. So at this point, this became kind of a tale of two cities, because we had already put together the DOJ grant and the proposal with the Richmond Police, and then we retooled that and reshaped it somewhat and submitted it so that we could submit the proposal for the Antioch Police Department. And I think it's important to think about when we're putting together proposals and seeking funding to think about the stakeholders in our communities, and these roundtables, these coordinating councils, and these other groups that exist in most jurisdictions and most counties are great places to really form the kind of community and these partnerships that can be really successful in both obtaining this funding and moving forward to have successful programs. So after the roundtable, we spent a lot of time, again, with the two police departments and talking about what the roles would be for each of the partners. And this was a very new approach. This was sort of an unlikely partnership, and we as a public defender's office, and I would venture to say most public defender's offices have never partnered in this way with a law enforcement agency. And, in the past, public defender and law enforcement relationships can sometimes be, more adversarial or contentious. So it was really a good thing for us to sit down and work around this shared and common goal and to have a more positive relationship and to look at the ways in which our relationship could be aligned. And one of the things that was really helpful when we launched the program was having training with each of the groups of line patrol officers. So, our program involves officers who are out on patrol, and as they cite people in a criminal case, they need to let people know about our program and do, a kind of outreach about our program, give the person a contact card. And so it was really important for us to reach each of those patrol officers and let them know what the goals of this program were. Let them know that, this program was about, in a way, freeing up law enforcement resources so they didn't need to chase people around on low-level cases who had missed their court date and arrest them and bring them into our jails. It would be much easier if we could work with those individuals and make sure that they knew about their court dates and could get there so we could avoid that whole process. And so as we gave a training to each set of the officers, we learned quite a bit. We not only gave information, but we listened to them and used those kind of as listening sessions to see what their thoughts were around the program. We also learned that, police briefings start as early as 6 o'clock in the morning, and the evening shifts are at 10 o'clock at night. So that gave us kind of a newfound respect for some schedules that were a little different than ours. And we wanted to make sure, that the officers understood the program and that we had a level of buy-in so that they would be willing to really give out our card and to let people know about our program and letting them know that they were sort of the first line in this program. That was going to be the first time that those who are being arrested or cited were hearing about the potential of being represented by our early representation team. And we also, through the program, have had a chance to look at the data. And this is a situation where we knew anecdotally that often people who were getting cited and asked to come to court 6 weeks after an event, 6 weeks after an incident with the police, we knew that charges were often filed much later than that. But being able to collect data on this program showed us that in 100% of the cases, people's charges weren't filed by the time they were told by the police agency to come to court. And we learned in those listening sessions that there was an officer who was entirely dedicated to handling those misdemeanor warrants and people who had missed their court dates. And we also learned that, we hadn't had any previous experience with federal grants. We had, again, this local experience getting this funding through AB 109. But eventually we did receive our DOJ grant as a partnership with the Richmond Police Department. We actually received it a year later than everyone else was funded. And we had to look at the structure of the police departments when we launched over in Richmond, because in Antioch, the structure was much smaller. The Richmond Police Department was about twice as large as Antioch. And so we had other lessons in our second partnership, which was with the Richmond Police Department. And, in realizing that it would take more effort to communicate with a police force that was twice as large, and that it was necessary and maybe takes a little longer to get that buy-in through all the different ranks of police agencies. So in each of our partnerships, that with the Antioch Police Department and then later that with the Richmond Police Department, we learned different lessons. And I would say the key lesson, though, is communication is quite essential in these programmatic partnerships, as it would be in any other type of partnership in one's life. So, we have staff that go into each police agency weekly, and that's been really helpful in regards to timing, in regards to communicating with law enforcement. And then, the tools that we use to communicate are tools like, email and phone calls. In Antioch, because of the size, I think we're able to have more casual phone calls and casual communication. And what we've learned in our relationship with the Richmond Police Department is that those communications tend to be a little more structured and formal. And so, we've worked hard in both our partnership with Antioch and with Richmond to make sure that, we get this buy-in from the chief, from the assistant chief, and from those that are high in the ranks. We've really leaned on them to use some additional tools that we didn't use in Antioch, which was a bit of a smaller, a smaller police force. And so in Richmond, we've asked them to issue a training bulletin that we authored, and then they, sort of put their stamp on it as a form of reminder. So kind of having more frequent written communication to the line police officers. And so, having frequent communication, reminders, and having people, told through email and trainings in person and training bulletins has been really critical. And again, at this larger police force in Richmond, it's taken a little longer to really have our message spread throughout the ranks. But one of the interesting things was that in Antioch, they didn't have quite as many community relationships or partnerships, but that was a longer tradition with the Richmond Police Department. So in Richmond, we hit the ground running, and we're able to work a little closer with reentry agencies and with the Reentry Success Center that is a one-stop center in that city. And we've been able to work closely with the homeless shelter because the Richmond police were linked up with them as well. And so what we found is that at each juncture, it's been really critical for us to circle around and remind our partners what the work is about, and to give them outcomes and talk about the successes we've had, both on more of a level presenting, the numbers and the data, and then also anecdotes about how we've been able to, avoid custody time for individuals, how we've been able to avoid having law enforcement officers spend their investigative time on these warrants when people have missed court dates. And in communicating our success to our partners, we want to make sure that we celebrate their wins and it's not going unnoticed. And we want to make sure we recognize that they're having an impact in this partnership as well. So we've tried to include them in our outcomes. We've done things like go address the city council in Antioch and let them know the work that their police agency is doing, and that they're doing extra work above and beyond to try to avoid unnecessary incarceration, and tried to have the sort of positive feedback spread through these messages to others in the community government, and community partners as well. So at this point, I think I'll go ahead and turn it over to Emily.
All right, great. Thank you very much. Just a couple of questions for you. Did you have trouble establishing a level of trust with clients who the police referred you to? Also, how does your MOU work with the police?
Sure. So one of the things that those are good questions. One of the things we try to do at the Public Defender's Office is obviously in our client-centered practice is to build relationships with our clients. And what we hear is that from people that we contact through early representation is that they are relieved to be contacted by us. They're in this very stressful moment of panic and trauma. They've just had a police contact, and often they don't know what's going to happen next. And so we start by just having a conversation with our clients and reassuring them that, you know, we're part of a special program called Early Representation. We're here to work for them, that, you know, everything we say to them and everything they say to us is confidential and it's covered by attorney-client privilege. And, you know, we know through our experience in working with our clients that trust is something you need to build with each individual client. And one of the things we're tracking and looking at closely is what is that impact? What is the impact of people reaching out to us, and what is the impact of people having heard about us through law enforcement? But what we've found so far is really that people are very happy that we're there. They're glad that someone can help them out in that moment of crisis and kind of shepherd them through this process. And so it is an interesting outcome that we are getting phone calls after people get the cards from police at initial citation. And, you know, in terms of the MOU, we are certainly, we collect outcomes in terms of whether or not people, how they were connected with us. We certainly don't, you know, in our MOU, it doesn't change any of our Sixth Amendment duties to our client. And through our MOU, it's very clear that we work for our clients and not for, you know, the police department. That certainly we get information from them about who was arrested or cited, but it stops there, and that we certainly don't provide any information back to the police department in terms of our conversations or our dealings with any of our clients. So that is very clear.
Okay, and what are some of the challenges likely to be faced with these partnerships?
Yeah, so for us, you know, communication, as I've already mentioned, has been a big challenge to make sure that we're communicating throughout each level of the agencies that we're dealing with. And that goes from the chief of police all the way down to the clerical person that works in the records department. And I think another challenge is in working, for us, specifically in our early rep program, has been working with clients that have issues around substance use disorder and are homeless. And so it's been really challenging to locate those clients, to continue contact with them. And that's been the population where it's been maybe the most difficult to really get people to their court dates and to connect them with social services that they're so desperately in need of. So, you know, we've been working on different strategies, and that's involved working really closely with our drug treatment providers in our community, working closely with our community partners, with our homeless shelters, with churches, and sometimes with the officers that have contact with individuals that are homeless or that are displaced on a more frequent level, just to make sure that we can you know, find people and work with them as frequently as possible up and until their court dates, and then you know, make sure they have the most support that they need in terms of getting to court and continuing to make their court dates after they do have that first court appearance.
Legal Aid Society of Columbus, and we started that maybe I think it's about 3 years ago now, and the connection actually came from one of our board members, and one of our longtime board members who had been on the board of the Adam Board in Franklin County. And our executive director and I met with the CEO of the Adam Board, and there was an immediate connection, meaning that he immediately understood the benefit of legal services to the clients of the different providers of the Adam Board. And we came to an agreement. We, created an MOU that described what we would do, what the organization, what to expect from the Atom Board. And at that time, I believe our contract was for $100,000 for a year, and that has grown over time. So it is certainly managed by our Legal Aid Society of Columbus, our urban program, and people who are clients of the various providers in Franklin County, where Columbus, Ohio is the capital of Ohio, refer clients through an ombuds person who works for the Atom Board. And that ombuds person helps to screen clients, and also then we can refer them to the different substantive law teams within the Legal Aid Society of Columbus. So that contract then has grown over time, and we are now part of their annual budget. So we are now a line item in the annual budget. And that partnership also led to a partnership to provide services to Atom Board clients who are incarcerated in the city jail or in the Franklin County jail. And that is still in the process of kind of being worked out. Sometimes it's difficult to get into the jail immediately. You have to kind of go through the various layers of authority and all of those kind of things. And so all of that bureaucracy is being worked out now. But we're looking forward to working with those clients as well. We thought that project might be a good one to try, meaning the partnership with the Atom Board. We also have a rural program, which is the Southeastern Ohio Legal Services organization that provides legal aid to folks in 30 counties in Southeastern Ohio. And we thought that we might be able to replicate that work with the Atom Board in one of our larger counties, and so we looked to the Atom Board in Scioto Paint Valley. Paint Valley is where Chillicothe, Ohio, Ross County is located, and we thought that might be a good fit for that county. It is one of our larger rural counties. So we approached the administration of Paint Valley Atom Board, and they agreed that they thought that legal services would certainly be useful to their clients, and we entered into an agreement with that organization as well. We also have a couple of different federal grant partnerships. We have worked for the last few years with the local workforce development organization in our community, which is called Alvis. At one time it was called Alvis House, and now it is Alvis 180. And I think their change in name is an indication not only of their growth in terms of the services that they provide and the number of clients that they serve. They serve clients all over central Ohio and actually even into northern Ohio, into Toledo. But they are a really strong partner, a really very well-respected workforce development organization in Franklin County. We've worked with them for a number of years, and we entered into a partnership first on a federal Department of Labor grant, and that is the Career Pathways grant. Our first partnership was with Alvis and Goodwill Industries and the local community college here in Franklin County. And that partnership then grew to another Career Pathways partnership for the second grant. They were successful. Alvis was the applicant and was successful in getting that grant and asked us to be a partner, and so that is called Career Pathways 2, and we just that grant was just awarded a couple of months ago. We also worked with them on the submission of another federal grant, which is the Department of Justice Second Chance Act grant, and we expect to hear about that grant very soon. Again, we will be a partner with them. We also are partners in several medical legal partnerships. So we are partnering with the local children's hospital in Franklin County, Nationwide Children's Hospital. That kind of began our medical legal partnerships. In our urban area and in our rural communities, we began a medical legal partnership that was funded in part by the Osteopathic Heritage Foundation, and that was a partnership with Ohio University and other community healthcare providers to provide legal services to at-risk pregnant moms in an effort to reduce infant mortality in several of our rural counties. From there, we also entered into another medical legal partnership, again through Ohio University, and this one focuses on adult type 2 diabetics, again in several of our rural counties. In our urban area, we expanded the general counsel at Nationwide Children's Hospital was really impressed with the medical legal partnership at Nationwide Children's and thought that there were some great opportunities for partnerships with the adult hospitals, and she introduced us to the general counsel at the 3 adult hospital systems in Franklin County. We had all banded together to work on ways to reduce infant mortality in Franklin County. Franklin County has one of the highest infant mortality rates, particularly in the Black community of any county in Ohio, and the hospitals wanted to really do something about that. And they thought, after we talked with them, that one of the ways that they could certainly help would be to provide legal services to women who were coming through their clinics, at-risk pregnant moms who were coming through their clinics, and they came together to provide financial support for medical legal partnership that is shared by the three hospital systems, let me say. We're also expanding the medical legal partnership with Nationwide Children's. We'll be going to the behavioral health clinic, so that will increase our work in schools and with kids in not only kids who are in elementary and high school, but also kids who are in preschool. We're expanding that also to some of the other ambulatory care clinics that the hospital operates around the city, so that partnership continues to grow. And we are now, that partnership is supported by the hospital, and we are now part of the line item with the hospital, with Nationwide Children's Hospital, being part of their line item budget. We are constantly looking for ways to increase our partnerships with organizations, and those are some of the partnerships that we have entered into. We are looking at we have started a medical legal partnership again in our rural community through Southeast Ohio Legal Services. One of the first, we think anyway, from what we understand from the National Center for Medical Legal Partnerships, one of the first medical legal partnerships with substance treatment facility is centered around our Portsmouth office. Portsmouth is in Scioto County, southeastern Ohio. And that partnership, that medical legal partnership, is supported by the Ohio State Bar Foundation and by the Counseling Center, who is our medical partner. And through that, we provide services to folks who are struggling with addiction. Portsmouth was recognized or mentioned in the book by Sam Quinones called Dreamland as the epicenter of the opiate epidemic in Ohio. Pill mills began operation in Ohio, at least first in a big way in Portsmouth, Ohio, and then kind of spread into other parts of southeastern Ohio and on up into central Ohio. Those were replaced by heroin as crackdown on pill mills became certainly the kind of law of the Ohio land anyway, making it very difficult to get pills, pain pills, OxyContin, and so on, and heroin took its place. So we are certainly in a huge opiate epidemic crisis right now, as many other cities are in Ohio. So those are our medical legal partnerships, and we're working now with the Counseling Center on how we can work with the local colleges actually to provide training for more substance abuse counselors, which they sorely need, but also how we can help to bring a higher level of training, meaning that as the changes in Medicaid occur in Ohio, there will need to be people with higher credentials, LISW, and so on. In Southeast Ohio, the opportunities for that level of education are very limited, so we're now working in an advocacy capacity to help legislators understand, to provide education to legislators and so on to help them understand that. We are also looking at starting another medical legal partnership in our rural area, and that one will be with the Resource Council. The Resource Council, or the Recovery Council. The Recovery Council is also a substance abuse treatment facility in southeastern Ohio that provides services in Chillicothe, Ross County, and several other counties around Chillicothe. And we are beginning, we did a survey of all of their clients, and using the results of that survey, we are seeking funding for that, or actually have applied for funding for that medical legal partnership. The survey works really well because it gives funders a real idea of what kinds of legal issues clients of the counseling centers have, clients of the substance treatment facilities have, and we make the survey as user-friendly as we possibly can. We list all kinds of different issues, and we just essentially ask them, have you had this issue in the last few months? Whether it's domestic issue, we go through a whole battery of different questions. So that has been very helpful in helping us to get funding for those medical legal partnerships that are working to hopefully resolve issues that may be stumbling blocks to people getting the kind of treatment or finishing the treatment that they need to get back on their feet. So those are our partnerships. Those are the partnerships around federal grants, the partnerships with ATOM boards. We're always looking for other ways to partner with organizations to serve our clients better, expand our services, reach a different part of our population, zero in on the kinds of particular issues that we know are prevalent in our communities, like opiate addiction, and also to think strategically about different organizations in our communities who are doing great work, who we want to affiliate ourselves with, like Alvis and like our community colleges, like Goodwill, like the counseling centers. Those are all organizations that are important to our communities, and our linking with them helps to not only expand our work, but it also helps us to diversify our funding. It helps us to think in new ways about how to provide services for folks. It also helps to lead us in different ways, different pathways that also may lead to different partnerships.